All right, welcome. Hold on. Welcome to Next Gen Tips and Tricks, provider test action. So we're going to be going over that template today. So what is provider test action? A provider test action is a template in which you can order future labs, diagnostic studies, and referrals. You can also send communication with other staff here at the clinic, but to do communications, I would recommend doing the telephone communication template or even clinical tasking if it's like a private message. Where to find provider test action. So to find it first, you would have to create a new encounter and then select the new folder icon here. Once you click on that, you'll create the appointment up here, the encounter here where it says new. Then you would go to the blue template button down here under custom. And then once you do that, this pop-up window will pop up and you want to check if you have provider test action under your preferred. If you do not, then you would want to go and click on all and then just look for that provider test action. Most likely it will be in the P section. Once you find it, you highlight it and then click OK. And that should open up the template. So provider test action, hold on. Welcome, Darcy. I started, but I can go back. It's only 2 slides back. I am also recording. This will be uploaded to the YouTube, so it should show up there as well. So just to reiterate again, what provider test action is, it's a template in which you can order future labs, diagnostic studies, and referrals. You could also send communications with other staff, but I would recommend using the telephone communication template or clinical tasking for sending communications with staff. So where to find provider test action? So first you would need to create a new encounter for the day. So by doing that, you click on this new folder icon and create the encounter, then click on the blue templates button, and then that should open up the little pop-up window. If you do have provider test action saved under your preferred, then you should find it there. If not, then you would click on all and search for provider test action. Most likely it will be in the P section. Once you find it, you highlight it and then click OK. And then you should open up the provider test action template via that route. Let's look at how it looks. So it looks like this. Just remember specialty and visit type. Visit type will be chart update. Specialty, it depends on which specialty you're under. And then now you can select for any of the ones you want to do. If you want to do a diagnostic study, if you want to order labs, if you want to order referrals or any of the others options, you can do that. So first you click on what you want to order. For example, diagnostic studies, you would highlight it. And then the next step would be click on add. And once you do that, this template will pop up. First, though, you want to go back to assessments and pick an assessment for that diagnostic study so they can be associated. So once you do that and find the assessment, you go back to diagnostics, and then you can either use the blue pick lists here, or you can do procedure IT. Procedure IT will open up and you can search for whatever diagnostic study you're looking for. If not, you can do the pick list on the right-hand side. And then once you do that, once you have them both filled in, you do place order, and then it should show up right here under ordered once you have it successfully ordered it. If it's not here, then you would have to go back and make sure you click on place order. After that, you would do save and close. If you were doing labs, same thing. You would have to go to assessments and get an assessment to associate those labs with. Then you go back to the labs template tab, and then you highlight the lab you wish to associate those labs with. Make sure your date is the date you want, like if it's a week from now or 2 weeks from now, whatever it is, and then you start picking the labs that you want to do, and then they should show up here under your ordered labs. Once you do that, you can do save and close if you've ordered all your labs. For referrals, same thing. You will need an assessment. So if you do have already an assessment in there, you can quickly order your referrals. If not, then you would have to go to the assessment tab. Okay, I'll go over that in a bit. And then you click on specialty, you click on specialist name / site, then specialty. And then you pick from the pick list, for example, pulmonology. And then number 3 would be clicking on description to associate it to one of your assessments or diagnosis. Once you do that, you fill out services requested, clinical indications, and then the last important one is time limit. Is it routine or urgent? And then last step is you click on add. Once you do that, it should populate down here under the status / order date. You should see the referral that you've ordered. After that, you can do close. And something else you could do here under provider test action is tasking. So first you need to fill out any notes, for example, like calling a patient or sending results. So once you have those notes in there, you could also click here on the to-do items, and then it says contact patient by phone, and it's contact about future labs, for example, if the labs that you ordered. And then there's other categories in here as well. Once you do that, once you fill out whatever you want to task, then you do save and task. And then you can task, for example, the coordinators at rows or any individual person as well if you want to find a person. Are you asking how do we respond to them?
Yeah, I feel that we get tasks in our inbox, and then somehow it's just not clear to me when I feel like I'm responding and then I don't get a response and from the provider, and I can't tell how to see that it's really gone out, or I don't know.
Do you get it via provider test action, or do you get it via telephone communication?
No, if it's a telephone communication, I know how to track it. It's that we get things via provider test action, and I know how to see it if it's in my inbox. But but then it doesn't show up otherwise in the chart, correct? Or can we see it otherwise in the chart?
So once you do test action, it should generate a document like the telephone communication ones. And then you should see everyone's response if they have responded to the messages, or if you responded to a message as well.
But people have to generate the document? Is it that maybe people aren't generating?
Yeah, most likely they are not generating the document. Some people don't even generate sometimes the telephone communication ones as well.
I feel like this all the time. It's like this is a real hazy area that people are sending things by provider test action, and then it's kind of there's not the right trail, but there's no way to change that if people aren't generating.
Yeah, like they would have to get trained and know to generate the document.
And the way I reply is so when I get it in my inbox, I see it as this little message, and then I can reply to it. And then I'm supposed to generate a document. Maybe I don't even know how to generate a document on this.
So you would have to go to the chart and then go into this template.
Okay.
And then reply via this route. Because I think if you...
Okay, so I don't even know. So I'm not doing it right either. Okay, so I have to, because usually it's there in my inbox and I respond to it. And then that's that. So it's not getting recorded anywhere either. So instead I have to go into the chart, go into the encounter, go into the template, and then I see all this. And then the document.
Yes. Yeah. We can go over a demo, or maybe even we can see one of your scenarios, or just demo it out.
Yeah, got it.
All right. Uh, I think there's like 2 more slides and then we could do that.
Sure, thanks.
Hmm. Checkout. Remember, if you do order any labs, imaging, or referrals, you do need a requisition or create the referral document for those orders, or else they won't be processed. They'll show up under checkout and other places, but they won't show up under the history, the patient's history, and that's where we need those documents. For example, for the lab or the coordinators. So you do that, you highlight labs and then do requisition. Diagnostics is the same thing. You highlight the diagnostic study and requisition, and then the referrals is the only different one. You highlight it as well, but this one is referral document. And then verify the documents and then sign off on them as well. Other uses for provider test action, you can use it for items that have immediate actions, such as signing off with your pack, such as mammograms, referrals, labs. So you can click on, so once you're in your pack, you click on chart, and then you do new, and then you follow the same steps, template, and then you do provider test action, and then okay. And then you can do those tasks. You can even complete and close the loop via order management for those studies, like such as mammograms, diagnostic studies, and referrals as well. You can reply to the sender. So if somebody sent you a message, so provide counseling, you just highlight it under the current encounter, and then you highlight it, and then you reply, you fill out your message, and then you reply to the sender. And then you choose the staff and then click OK. So that pop-up window will show up, and then the tasking window will show up, and then you can search for the staff that you want to send it to and then click OK.
Now, see, when I do that, I feel, so if it says reply to sender, you still have to choose staff. Isn't that, if you're replying, because I feel like I don't get a pop-up to, again, when it's in my inbox. And
Let's take a look. Let's see. Let me stop the recording. I'm gonna